Hello and welcome to our training, Small Mistakes, Big Consequences, DSP Training Essentials by Vagthal's Residential Care Center. As direct support professionals, we are not just employees, we are caregivers, protectors, teachers, and mandated reporters. Every action we take directly impacts the safety, dignity, and quality of life of the residents entrusted to our care. In ARF and RCFE settings, small mistakes can lead to serious consequences for the resident, for the facility, and for you personally. Compliance with Title 22, HCBS Final Rule, medication safety, infection control, safe feeding, proper transferring, behavior management, and professional conduct is not optional, it is our legal and ethical responsibility. These scenarios reflect real-life situations and the most common errors seen in care facilities. Your ability to respond correctly demonstrates your competence, professionalism, and commitment to resident-centered care. Remember, you represent this facility at all times. What you do and what you fail to do matters.
Imagine giving medication at the wrong time. This simple mistake can lead to severe health consequences. Always ensure the right timing to avoid complications.
Signing the MAR before administering medication is risky. It can lead to errors and accountability issues. Always sign after administering to ensure accuracy.
Common DSP mistakes related to timing. Giving whenever convenient. Waiting until resident returns from day program without updating MAR. Signing MAR before giving medication. Not clarifying vague physician orders. Not adjusting MIR when schedule changes. Title 22 perspective. Licensing sees late medication as medication error. Failure to follow physician order. Potential neglect, even if resident appears fine. Best practice in residential facilities. If medication time conflicts with day program schedule, verify physician order. Clarify if time-specific or frequency-based. Update MAR to match actual administration time. Notify pharmacy if needed. Document properly. Never assume time flexibility. Failing to report medication errors is a serious violation. It compromises resident safety and care quality. Always report errors to maintain trust and safety.
What to do if error happens? Notify administrator, RN immediately. Assess resident condition. Monitor vital signs if needed. Complete incident report. Document truthfully.
Documenting refusals and checking vitals are crucial. Missing these steps can result in dangerous oversights. Always document and verify before proceeding. Complete and lock notes before the end of shifts. This practice prevents errors and ensures all information is up to date and secure.
Late charting and copy-paste notes can lead to inaccuracies. Ensure timely and accurate documentation to maintain integrity and accountability.
Why it matters. Licensing citations. Legal liability, loss of facility credibility, risk to resident safety. Golden rule. If it wasn't documented, it didn't happen. If it didn't happen, don't document it.
Leaving residents unattended poses significant risks. Always ensure supervision, especially for fall-prone individuals. Your presence is crucial for their safety.
Common DSP mistakes in resident safety. Leaving residents unsupervised, especially fall risk or seizure risk residents. 2. Phone use while supervising. Texting, earphones, or personal calls during care. 3. Not following transfer orders. Ignoring two-person assist or not using gate belt or Hoyer lift. 4. Unsafe feeding practices. Rushing meals, not positioning upright, ignoring special diets. 5. Not monitoring during meals. Choking risk when staff are distracted. 6. Ignoring full precautions. Using phones or earphones during shifts distracts from care duties. Stay focused and attentive to ensure resident safety and well-being. Phone use while supervising residents, such as texting, earphones, or personal calls, reduces awareness and delays response to emergencies like falls, choking, or seizures. Even brief distractions can lead to serious injury. In ARF RCFE settings, this may be considered lack of supervision and can result in licensing citations. Full attention is essential to ensure resident safety. Proper food handling and equipment cleaning prevent contamination. Ensure all surfaces and tools are sanitized to maintain a safe environment.
Common mistakes in food preparation safety in ARF RCFE settings include not washing hands properly, not wearing gloves when required, cross-contaminating raw and ready-to-eat foods, failing to label and date food items, storing food at improper temperatures, and not following special diet instructions. These errors can increase the risk of foodborne illness and may result in health code violations or licensing deficiencies. Proper hygiene, safe storage, and adherence to dietary orders are essential to protect resident health. Hand washing and glove changes are vital for infection control. Neglecting these can spread infections. Always practice proper hygiene to protect residents.
Unexplained bruises and falls must be reported immediately. Delayed reporting can worsen situations and lead to violations. Always notify the RN or admin promptly. In ARF RCFE settings, delayed or incomplete reporting can result in licensing deficiencies and serious compliance violations. Timely, accurate, and complete reporting is essential to protect residents and the facility. By implementing these practices, you'll enhance resident safety and care quality. Your role is vital in creating a supportive and safe environment. Avoid using baby talk or disrespectful tones. Respectful communication fosters a positive environment. Always speak kindly and professionally.
Common mistakes in respectful communication include using rude or dismissive language, talking down to residents, baby talk, raising one's voice, arguing instead of de-escalating, speaking about residents in a negative way, discussing confidential information in public areas, not greeting residents or visitors professionally, and using a language the resident does not understand in front of them. In ARF RCFE settings, respectful and professional communication is required to protect resident dignity, rights, and compliance standards. Offer choices and promote independence. Forcing routines or restricting access violates residents' rights. Encourage autonomy to enhance their quality of life.
Common mistakes in offering choices and promoting independence include forcing residents to follow staff schedules instead of personal preferences, completing tasks for residents that they are capable of doing themselves, limiting access to activities or items without a documented safety reason, failing to provide options for meals, clothing, or daily routines, and not supporting residents in making decisions about their own care. In ARF RCFE settings, these actions may violate resident rights and HCBS person-centered standards. Staff must encourage autonomy, respect individual preferences, and support independence whenever safely possible to enhance quality of life and compliance. Involve residents in community outings. Participation boosts morale and engagement. Always seek opportunities for inclusion. Common mistakes in supporting community inclusion include not offering residents opportunities to participate in outings, assuming they are not interested without asking, cancelling activities due to staff convenience, failing to follow person-centered plans that encourage community engagement, and not providing the required supervision or support to safely attend events. In ARF RCFE settings, limiting community access without a documented safety reason may conflict with HCBS person-centered standards. Staff should actively encourage participation, provide appropriate support, and document choices to promote inclusion and quality of life.
Adhering to dress codes and avoiding personal issues at work is essential. Maintain professionalism to set a good example and ensure safety.
Common mistakes in this area include not following the facility dress code, wearing inappropriate or unsafe clothing, using excessive jewelry that may pose safety risks, and presenting an unprofessional appearance while on duty. Other errors include discussing personal problems with residents, displaying negative emotions in front of residents, arguing with co-workers in common areas, or allowing outside stress to affect work performance. In ARF RCFE settings, professionalism is essential because staff represent the facility at all times. Maintaining proper appearance, emotional control, and workplace focus supports resident trust, safety, and compliance with licensing standards. Follow behaviour plans and emergency responses. Consistency in approach ensures safety and effectiveness. Always adhere to established protocols.
Avoid yelling or improper physical redirection. These actions escalate situations. Use de-escalation techniques to manage behavior effectively.
Common mistakes in behavior management include yelling, using threatening language, arguing with residents, or using unnecessary physical contact to redirect behavior. These actions can escalate situations, increase anxiety, and lead to injury or complaints. In ARF RCFE settings, staff must use approved de-escalation techniques, remain calm, maintain a respectful tone, and follow CPI training and behavior support plans. Physical intervention should only be used when authorized, trained, and necessary for immediate safety. Professional de-escalation helps protect resident dignity, prevents incidents, and supports compliance with licensing standards.
Recap: we've covered medication errors, reporting, supervision, infection control, professional conduct, HCBS compliance, documentation, and behavior management. Each aspect is crucial for providing quality care.
Call to action. Apply these insights in your daily routine. Your commitment to excellence makes a difference. Let's continue to improve and provide the best care possible.